My experience working at the Victoria Hospital has been a great one. I came from a tertiary care facility prior to moving to Prince Albert, and I found the Victoria Hospital to be very welcoming, very friendly.
When I came initially, I felt it was going to be a bit of a challenge, but the challenge has made you grow. It's been a wonderful experience so far. It's small enough to know you, but big enough for you to do whatever you really want to do. There's a good collaboration and a sense of community. I have no doubt that whoever decides to come to Prince Albert will have absolutely no problem settling down and getting engaged in the physician community as a whole. You feel as if you are making a contribution to the community when you work here.
As the Director for Acute Care Nursing, I look after a variety of acute care areas. That includes medical floors, surgical floors, a busy emergency department, a busy operating room. We have services such as ENT, urology, ophthalmology. We're a very busy obstetrical unit, and we have a high acuity pediatrics ward, 7-day-a-week emergency department staffed by dedicated emergency physicians.
The unique thing about coming to PA is that you have an opportunity to develop the program the way you see fit, based on your own needs and based on the needs of the community.
You have the opportunity to be very involved in the selection of equipment and supplies, and you have the opportunity to visit neighboring communities to provide itinerant services.
The town itself is unique in the sense that you get to know most people who work in the hospital. With regard to the urology program, there is a high percentage of geriatric patients. There may be a bit of traveling to other smaller communities, which is important because you get to see where people really come from.
Our working relationships at the Victoria Hospital are extraordinary. It's much more close-knit. You have a greater ability to work as a team because the departments are smaller. It's a lot easier to access the people that you need. So if you're trying to do some quality improvement work or patient safety work, it's really easy, and the staff have very much an attitude of how can we help. If they can make it work, they'll make it work. You have the opportunity to practice in a community of multiple different kinds of physicians. You become very quickly a team member in the departments like ambulatory care, the inpatient units, as well as the operating room.
When I came here 10 years ago, I thought I'll be here for about a year or so, but I got hooked and I've been here since then.